Singapore is stepping up public health measures against measles as cases rise locally and around the world. The country recorded 11 cases in January. During the same period last year, there were just 2 cases. The Communicable Diseases Agency says the moves are precautionary. It's urging people to stay up to date with vaccinations, as Sherlyn Seah reports.
Measles is a highly infectious viral disease. It can cause complications in the lung or brain.
The symptoms of measles include fever, a rash that usually begins in the face, a cough, a runny nose, and conjunctivitis, which is red or watery eyes. So if you have these symptoms and you think you could have measles, please see your doctor and get tested. And obviously limit exposure to other people until you've been tested and that you know you don't have measles.
Measles can spread easily among the unvaccinated. All 11 cases recorded in January were not fully vaccinated. They include 3 infants who are too young for immunization. 10 live in Singapore, while 1 is a tourist. 7 of them had travelled overseas recently. CDA says there is a possibility of undetected community transmission, with 3 cases that are genetically linked, despite having no known contact with one another. And while Singapore maintains a high vaccination rate, authorities are making early moves as a precaution.
There are still small pockets of people here who, either because they are immunocompromised and unable to mount a response and immunity against measles, or because there are children below the age of 12 months who have not yet received their MMR vaccine, the measles vaccine. So to protect these vulnerable groups, small pockets of vulnerable individuals in our community, we decide that public health measures are necessary to form a protection around them.
Under the enhanced measures, confirmed cases will be isolated until they are no longer infectious. Unvaccinated close contacts may be quarantined for up to 21 days. High-risk contacts, including young infants, pregnant women, and the immunocompromised, will be offered post-exposure treatment. Authorities also warn that failure to comply with isolation or quarantine orders may result in fines or jail time. The rise in cases here mirrors a broader global trend, with the World Health Organization recording 11 million measles cases in 2024. Several regions worldwide have also seen multifold increases year on year. And as a global travel hub, CDA says Singapore remains exposed to imported cases, and residents who travel overseas may also be at risk of getting infected. Posting on social media, Health Minister Ong Ye Kung says vaccination is the best preventive measure. It plays a key role in maintaining herd immunity. The public is advised to check the vaccination status, practice good hygiene, and seek medical attention early if unwell.
So how real is the measles danger for Singapore? We put that question to our infectious diseases expert who joins us now on Zoom. Dr Leong Hoe Nam is from the Rophi Clinic at Mount Elizabeth Medical Centre. Now, Dr Leong, there's been a rise in cases in Singapore right now. We're looking at 11 cases in January. What is driving this increase? And could it be an early sign of local transmission?
Let's be very frank, the threat is real. It is not just a Singapore phenomenon, but it's happening globally as well. It's not a third world problem, it is the whole world problem as well as the first world developed countries. You can be in Texas, you could be USA, you could be France, any part of Europe. There are measles outbreak there. Why is all this happening? It's because of a lot of people are not vaccinated. Anti-vaxxers, they're not choosing to vaccinate. Number 2, we do have global travel. We're traveling to many different places. Number 3, we do have individuals in the surrounding countries who are coming into Singapore who do not or who have not been vaccinated because of previous home situations and the poorer socio-economic environment. So in all these, it is a conglomerate of all these factors that we see a rise in measles. And Singapore has borders are very porous, which means the cases will come in and go easily.
Now, there are 3 cases with no known links to the other infections. So how concerned should we be about that? Does it then suggest that there might be silent community spread?
Absolutely. I think the silent community spread is always real. Now, they are genetically linked. You would thus think that one source passed it on to the 3 people. But you must also understand that in measles, you can have transmissibility 4 days before the onset of rash. So I feel well today. I would travel, take the bus, take the MRT, visit a few tourist sites, or even do my usual work routines, etc. before I end up with rash. And during the 4 days, I could be spreading the virus to many different people. In other words, the risk and the exposure is unknown because you can't detect the enemy. We will spot someone with a rash with red eyes and we're not going to go near them. But these people can transmit even before the onset of symptoms.
Now, Dr. Leong, can you clear this up for us? We know that Singapore has had the measles, mumps and rubella or MMR vaccination program for many years now, and also that measles cases are very rare here. So why are we suddenly seeing more cases now? What might be contributing to this rise?
I think we're seeing a lot of cases that are being brought into the country from travelers, foreign nationals who might be working in Singapore, or even Singaporeans traveling to other countries, first world countries, which never had measles before, or we might be traveling to countries that are a little bit more off the beaten track, and thus they bring measles back into Singapore. So it's actually a conglomerate of all these cases. In addition, Singapore's measles vaccine was in line with the rest of the world. But when they first rolled it out, they only had 1 shot. It wasn't compulsory. So they had 1 shot initially. They made it compulsory later, somewhere in the 1985. And thereafter, they made it a compulsory 2 shots vaccines. So if you have only had 1 shot, you're about 90% effective in vaccinating. If you have 2 shots, you are 95% effective in vaccinating. But measles is so highly transmissible. 1 case spreads on to another 15 cases, which means you just need 1 such case and it can break through the barrier which we have. What do? Make sure all of us are at least up to 2 vaccinations. With that, you can stand up in arms with the rest of Singaporeans and defend those who are really weak in the society.
And even in taking these precautions, would you say that there are certain age groups or communities where protection from the MMR vaccine may actually have weakened over time?
For measles MMR vaccine, if you have actually had 2 shots, the protection is actually very, very good. We think it is actually lifelong. However, there are some individuals who are immunocompromised, the kidney transplants, the liver transplant patients who are taking drugs that lowers down the immunity. In these individuals, if they were to get measles, the initial immunity which they had is kind of forgotten, and in turn, they can actually fall sick again. There's always that potential risk.
And for people who are concerned now, and based on the latest measles cases detected here, what are some of the key signs and symptoms that the public should look out for? And when should someone start seeking medical attention?
Initial presentation, it sounds like any flu-like illness. You could have a fever, you could cough, you have a runny nose. But what is rather characteristic of measles is the blotchy rash, and thereafter the red eyes. If you have a cough, you have blotchy red eyes, and you have a blotchy skin, think of measles. Or if you see someone like this, go and see a doctor straight away and confirm the diagnosis. There are a few clinical signs that can help us determine measles early in the diagnosis.
Dr. Leong, thank you so much for your advice. I've been speaking with Dr. Leong Hoe Nam from Rophi Clinic at Mount Elizabeth Medical Center.